I was at work the other night, in the middle of the night, and I got 3 really sick patients at the same time. One of the patients I got was an elderly lady, a 78-year-old with atrial fibrillation, and I introduced myself and I asked her how she'd previously been managed. And she was able to tell me that she had previously received an oral medicine that we commonly use to cardiovert patients or treat this type of rhythm problem. And she asked me whether or not she could also receive an intravenous medication, and I explained to her, well, if you've previously tolerated the oral medication, it might actually be safer because all of these medications can have side effects. And so I said to her, do you mind if I give you the oral drug? And she said, no, go ahead. The problem with a lot of our systems is that we'll have a system for the hospital encounter, but then once I go home, I'm no longer in hospital. And my family doctor doesn't have that same system as the hospital. And so they often don't communicate the medication information or the adverse drug event information because they are not integrated. It had been so busy that I had briefly looked at her chart before prescribing the medicine, but I certainly didn't have the chance to go through the 26 consultations in detail that this type of patient had documented in her record. And about an hour later, I was called to her bedside and her heart rate was only 25 and her blood pressure was only 55 and she looked gray, she looked terrible. And I thought, oh my gosh, had I known, I would have never prescribed that medicine. I was worried she was gonna die. So I started resuscitating her. And fortunately, we were able to stabilize her and she got over this episode. When I went back in her chart after this had happened, I actually realized that there was a discharge note with a cardiology consultation that documented that this patient previously had severe bradycardia due to this drug called propafenone. We think there are 1.7 million emergency department visits across the country every year because of an adverse drug event. We know that 1/3 of these events are repeat events. In other words, the patient has already been exposed to that drug or that drug class and has previously already suffered an adverse drug event. It just underscored for me the importance of having a system in place that helps us keep patients safe. So ActionADE has been around since 2020. We integrated it with the provincial dispensing database, and since then it's been actively capturing adverse drug events and integrating or sending those reports to the PharmaNet database. People like me just want to make care safer for our patients, and that's really what ActionADE intends to do.